It's really hard as a person of color, especially as first-generation students, navigating through the education system for the very first time in our families. We feel like we're not allowed to fail, and I think that's what gets to us.
That was 20-year-old Christopher Garcia Mendez, a student at Palomar College in Southern California. Like many college students, he has struggled with mental health issues. Welcome to Sparking Equity, a new podcast series focused on the best strategies to help all students succeed. In this episode, we'll look at what emerged during the pandemic as a crucial and all too often unattended barrier in the way of student success: mental health. I'm Lande Ajose, Managing Director at the Waverly Street Foundation. For those of you who don't know me, I've been examining the post-secondary landscape for many years. I was formerly the director of California Competes, an organization that focuses on higher education policy, and served as the chair of the California Student Aid Commission. More recently, I was the senior policy advisor to Governor Gavin Newsom on higher education issues. So let's jump in. There's compelling evidence that low-income students and students of color have greater unmet mental health needs compared with white students, and too often they attend campuses that are least likely to offer them the support and services they need. Christopher Garcia Mendez is a first-generation Latino student who came to the United States from Mexico with his undocumented parents. At the moment, he feels he has limited support from his family. His mother is back in Mexico, where she had to return to apply for a green card.
My mom's not here, but we talk over the phone and she keeps telling me, "Mijo, you got to make me proud." I don't have a dad. I don't have anybody to rely on. It's myself out here alone. I still had the moral support of my mom, over the phone, virtually or whatever, but I felt alone navigating through the system.
Fortunately, Palomar College, a community college in San Marcos, an hour north of San Diego, has been able to respond to his needs. But that's not typical of many colleges, especially community colleges. Later in the episode, we'll pay a visit to Palomar College for a closer look at how it is involving students in tackling head-on the mental health challenges they face. We'll also hear more about Christopher's own journey towards restoring his mental health. That includes using his position as student government president to advocate for more responsive services on campus. But first, I'm glad to welcome Dr. Khadija Booth-Watkins to talk about the issues that Black students are grappling with. She's a psychiatrist and associate director of the Clay Center for Healthy Minds at Mass General Hospital in Boston. She's joined by Tony Walker, a senior vice president at the JED Foundation, a national organization helping colleges more effectively address mental health challenges. Welcome, Tony Walker and Dr. Booth-Watkins.
Thanks for having us.
Thank you.
So I want to start by talking about equity and the particular mental health challenges faced by students of color. Can you give us a sense of what kinds of psychological distress these students are facing?
What happens is, as a result of their life experiences, Black students have an extra burden, which really negatively impacts their mental health. And so when we think about racism, discrimination, them being the victim of violence, and then there's a lot of fear around violence being perpetrated against them and brutality. And so there's this overwhelming fear for a lot of them for their safety, fear and worry about the future. And so like a lot of kids who are transitioning from, adolescence to adulthood, what does this world have to offer me when I get ready to join it as a functioning adult? And so worries about what the opportunities will be for them, what the world will look like, especially, again, when we think about this in the context of structural racism and, being worried about being barred from opportunities and experiences due to the color of their skin. And so these are things that are grave concerns for them that are not worries typically for kids of the majority. And then the other part of it is just really also the stresses, even if they're not themselves witnessing a lot of violence or the victim of a lot of violence, they're seeing a lot of this on news and in print and in the media. And so having to watch over and over again someone that looks like you be the victim of violence and be brutalized is stressful. And it really creates a lot of angst and worries and fears in our young people.
Tony Walker,
We know that throughout the pandemic, really the 10 years leading up to even the start of the pandemic, suicide rates amongst young people and suicide ideation rates were at an all-time high, right? As well as the prevalence of other mental health issues. So young people, I think in general in our nation, have been struggling for quite some time. We also know, of course, that the pandemic exacerbated all of those numbers. I think from the system side, there is a lot more that can be done. All day, every day, I talk to education leaders across the country, and I have yet to meet one who has told me that mental health issues aren't real, that they don't need to do more about mental health. I think education leaders across the country know this is top priority. The issue is that education leaders, whether we're talking higher ed or K through 12, in my experience, they just don't always know how to build these programs, build these services in a way, just to build them at all, right? But let alone necessarily in an equitable way that reaches all students effectively. And so I think that's where organizations like the JED Foundation really come in, that we can help provide that expert guidance in terms of how systems build these types of programs. And so for us, equity is a through line that runs through all of the work that we do. Equity surrounds all of it because we know that you have to design programs to be able to reach all students and to be effective with all students in terms of really helping to improve their mental health outcomes.
One generalization that we have is that Black students maybe are less likely to seek help than some of their white counterparts. Is that a fair generalization? Is that something that we are still seeing happening, or is the zeitgeist shifting at all?
I do think that's a fair generalization. We do have to be careful to not overgeneralize because there is so much heterogeneity among Black students, but there are a lot of barriers and reasons why this might be so. And I think one of the biggest is the stigma that exists still in the Black community around mental health and mental health treatment. And what are some of these kinds of misconceptions that are continued to be carried on from generation to generation. So I think that's one of the biggest barriers. But there are other barriers that are barriers to most people as it relates to mental health treatment, the cost, the access. And then when we also think about what mental health care and providers look like, there are only 2% of psychiatrists that are Black, and I think only 4% of psychologists that are Black. And so really trying to diversify the workforce would be really helpful to feel more inviting and welcoming to people of color. It is not to say that you have to look like me in order to treat me, but it does make you feel more comfortable, more at ease. You feel less inclined to have to explain your experience. Again, I think we have to be careful here, but because I look like you does not mean we have had the same experience. But there probably are some similarities and some overlaps that will be easier for us to navigate in the room and in the session. And also, I probably will be able to understand some of the nuances a little bit better than someone maybe who does not look like you.
Part of what I'm curious about is the extent to which the challenge with accessing mental health is primarily coming from the student who is not finding what they need versus the supply side, where we don't have the institutions and the structures that are appropriate for our students. And I'm trying to figure out, is it balanced on both sides of that equation, or is it more that our institutions need to kind of up their game, or is it that we need to really work on having students feel more comfortable seeking the support that they need?
I do think we're doing better on the side of the student as it relates to them feeling more comfortable seeking and talking about, mental health and mental health concerns. And I think we've really accomplished this through education and conversations. People are talking about it more freely, which makes it more transparent. It really gets away from that it's just me and feeling alone and alienated. So I think that has helped a lot, but we still have a long way to go because often it's not the young people. It usually comes from typically the parents and grandparents. So how do we extend the education as it relates to mental health? How do we dispel some of these myths and misconceptions to help people feel more comfortable? I think there's also, we can't get away from the historic interaction with the healthcare and the experience that Black people have had long ago when we think about the Tuskegee experiment and things like that. So I think that still weighs, even though they haven't experienced it firsthand, like it's historical knowledge that's passed on and passed on. So there is that mistrust. But I think we're doing better in that regard, but we do have to make the services more diverse, more accessible, and more user-friendly.
And it also means that those relationships have to be trusting relationships in order for students to actually access those services or for an adult to get a student to a service that they might need. And so I'm wondering what you think needs to happen so that we have more adults, faculty, staff, administrators who are all aligned to make sure that students are accessing the services and that we're meeting students really where they're at.
That is really critical as we think about trusting relationships. I'm not going to trust you to go and seek help from you and be vulnerable with you if I don't trust that you have my best interest. And I think we do have a little ways to go, because similar to the way many Black people feel about the healthcare system, they haven't always been treated well in the educational system too. And so I think we have to be mindful of that and have to be deliberate about really trying to restore, repair those relationships, but really make sure the school feels like a safe environment so they can access the care that hopefully is being built to best meet their needs.
Tony Walker.
There is also work that we can do on the student side in terms of helping to train students, helping to build competency in their own help-seeking behaviors, right? And so like when you look at the JED comprehensive approach, that's actually one of our domains, is making sure that there are systems, there are programs in place that are actively working with young people to train them how to recognize their own emotions, their own signs and symptoms of a mental health issue, their own needs, so that they can also advocate for themselves and recognize like when they need to go and seek additional help.
One feature, I guess, if you will, of the pandemic is that there has been a lot more attention on issues of mental health, which has meant that money has flowed from state governments, federal government, to institutions to support mental health services. What's the best bang for buck when you think about where that money ought to be spent? Is it in peer-to-peer support? Is it in hiring more therapists of color? Is it in setting up suicide prevention hotlines? I'm just trying to get a sense of what should institutions be thinking about in terms of where they should be directing those dollars and how to build something that is sustained in terms of the influx of resources that they may now have.
When I think about what has the most bang for the buck, we put a lot of emphasis on treatment and clinical care, but we don't put enough emphasis on education. And I think that is really going to give us the most bang for our buck, teaching people what the signs and symptoms are, what they need to do if they're experiencing them, when they need to be worried and escalate to the next level is so important for students, teachers, administration, and anyone really who has any real access to young people, so that we can really either ideally prevent illness and disruption, and if not prevent, really intervene early. And prevention and early intervention has the best outcomes in all of medicine. And sometimes we get depressed because we might be vulnerable, and what I need to do if I start to feel depressed, and not to wait until the bottom falls out. And I think that is really so critical, and that has been missing in so much of the work that has been done, whether it is the Surgeon General's call to action or, the declaration of the crisis that we're in by the pediatricians, psychiatrists, and Children's Hospital. There's not enough talk about the role of education as it relates to mental health.
The other piece that you mentioned earlier, Lande, was like around social connectedness and just like making sure that young people feel like they belong in their school environment, whether that's higher ed or K-12, right? And so even investing some of those dollars in like school culture and making sure that there are opportunities for connection between young people with each other, between young people and faculty and staff and leaders is also a really important piece of the pie.
That was Dr. Khadija Booth Watkins, a psychiatrist at Mass General in Boston, and Tony Walker, the senior vice president of the JED Foundation. Now, let's take a trip to Palomar Community College in San Marcos, California. That's where Christopher Garcia Mendez, who we heard from at the beginning of this episode, is now working on an associate degree in math and science. Palomar has placed students at the center of its efforts to meet their mental health needs. Louis Freedberg, a veteran education journalist and also the executive producer of this podcast, takes us there.
Well, hello, everyone. Thank you so much for coming. Today is going to be our Coping with Depression workshop. I'm Jasmine, and I'm a counseling intern here.
And so begins a workshop on coping with depression at Palomar College. A group of a dozen or so students are listening attentively in the brightly painted World War II-era bungalow just recently turned over to the college's expanding Department of Wellness and Behavioral Health. Other workshops deal with topics like stress management, self-compassion, and coping with anxiety.
And depression can also cause you to have trouble doing normal day-to-day activities and can cause you to lose interest in a lot of things that you probably have found interest in before.
The sessions are just one of a series of workshops offered by the Student Wellness Advocacy Group, or SWAG as it is called on campus. is just one part of a big push at the college to involve students in how to help their classmates face difficult issues that are getting in the way of their schoolwork. Palomar College is a 2-year community college. It has a student enrollment of over 20,000 students, about 40% of whom are Latino. And unlike many 4-year colleges, it faces a big challenge in offering mental health services to students who don't even live on campus, are often older, and are enrolled mostly part-time. Reaching students of color, who make up the majority of the student body, is a particular challenge.
Our services are for all students, but we recognize that students of color, historically marginalized students, they're dealing with generational trauma. They're dealing with microaggressions, macroaggressions on a daily basis.
That's Palomar College President Star Rivera-Lacey. She's the first Latina to head the college and, unusual for a college president, happens to have a deep background in counseling.
Historically, the field did not include minoritized populations. And so what we're doing differently now, what feels different, is that we're being intentional and we're meeting students where they're at, understanding their reality, and not pathologizing their reality.
Fortunately, President Rivera-Lacey says, students are now less reluctant to be open about their mental health challenges.
Growing up as a woman of color in a Latina household, mental health wasn't discussed. It wasn't discussed in the open. And so what we're seeing now is that in many communities of color that historically have not had conversations around mental health, those conversations are happening in safe places, and it's being normalized. As well-intended as the therapist, the counselor is, if they don't understand the cultural realities and the backgrounds, in some cases they can do more damage.
One of the students who talks frankly about the mental health issues he has been grappling with is Christopher Garcia Mendez, whom we heard from at the beginning of the episode.
It got to the point where I wasn't being myself. I was frustrated. I was feeling hate, anger. And, I didn't know how to deal with this.
Christopher says that at first he was resistant to getting mental health support, in part because as an immigrant he felt some guilt about taking advantage of the college's resources. But he turned to a professor for help.
I told her, hey, you know what? This is how I feel. I don't know how to deal with my emotions. I feel alone. I feel like I have no support. I can't work. I can't do anything. I don't have my parents to rely on to help me with food insecurity, with home insecurity. Like, how am I going to pay my rent? How am I going to do all this?
With his professor's encouragement, Christopher reached out to the Student Health Center.
I called and, I instantly had someone to talk to, like, right there on the moment, and I got an appointment right there and then that same week. And they let me know that if I wanted to do more meetings a week, that they were available to do that.
And he also applied for and received food from the Food and Nutrition Center.
I ended up receiving those resources, and I thank God that I actually did, because I don't know, I probably wouldn't have been here if I didn't.
In fact, getting his mental health and other needs met made such a difference that Christopher went from feeling hopeless about school to running successfully, not once, but twice, for student body president.
I wanted to make a difference here on campus. And, well, here I am now. I just got reelected, and so now I'm just looking forward to another term.
And as student body president, is now become a big advocate for mental health services on the campus.
Especially because I've been through it. I want to make sure that students that are also going through what I've gone through, they know that these resources are out there. So it is something that I am a huge advocate for.
Evelyn Galan is another leading student advocate at the school. She's majoring in film and hopes to transfer to a 4-year university to continue her studies. Her involvement in mental health advocacy also emerged out of her own struggles with depression.
Throughout my life, I've always kind of had moments where maybe there's been weeks or months that I've felt sad, but at the time I would just brush it off. I would say, oh, it's not depression. I would think that maybe I didn't have it as bad as other people. But just this year, I decided to actually do something about it.
She realized that her battles with depression were having a direct impact on her studies.
Depression really does affect everything else that's going on around in your life. And I have noticed that it has affected my motivation when it comes to doing work that I need to for school, or the motivation to keep studying. When you're in those moments, that motivation kind of fades away and you start thinking, well, why am I doing this? Or what am I doing this for?
Like many of her fellow students, she wasn't really aware of what services were available on campus. But then she was selected for a paid fellowship offered by Active Minds, a nonprofit organization with 600 student-led chapters on college campuses around the nation. As part of her fellowship, she helped create an Instagram page on mental health at the college. She set up informational tables and launched a college-wide campaign called Comet Strong, targeted at students of color. The goal is to go beyond thinking about mental health services as just about counseling and therapy, but creating a culture and a climate where students can talk openly about mental health.
So welcome to another Comets Care Network meeting, where we are discussing our students, particularly those that may have be underrepresented on campus or may have be particularly vulnerable to not being able to achieve their goals here at Palomar. So we come together to try to brainstorm how we can best support our students. And I'm going to just start us off by maybe doing a little check-in. So
that's Dr. Patrick Saviano, Director of Behavioral Health and Wellness on the Palomar campus. Once a month, he convenes a meeting of all the key players on the campus involved with mental health services, including the student advocates. It's called the Comets Care Network, which also emerged out of the efforts of Evelyn and other students like her. When Dr. Saviano was hired in 2019, he was the campus's first full-time therapist. That compared to the more than 30 therapists at the University of California, San Diego, just an hour away where he was working at the time. Now the Palomar campus has expanded its roster of therapists and counselors, including 2 recently hired full-time therapists. One is Latina and the other is African American.
Our clinicians need to be able to navigate some complex clinical issues. It's not always straightforward. And with less resources in the community colleges, we have to rely on each other as a team and others on our campus who provide support, but then also clinics off campus if there's a longer term need for students to make sure that they're connected, not just while they're here, but that they have health care and a plan when they leave Palomar. Because many students leave after 2 years, many leave after a semester, or they may come back intermittently. And so we have to kind of help them navigate each of those changes.
Saviano says that finding therapists from diverse backgrounds remains a challenge. But what is most important is finding therapists who demonstrate what he calls cultural humility, so that students feel welcomed on campus and in therapy sessions.
We have to be lifelong learners and learn along with our students who are challenging us every day with our language, with new cultural phenomenon that we have to pay attention to and be up to date with. And so we're looking for therapists that are on board with that have a social justice mindset, that are multiculturally not just sensitive, but humble, that they're willing to continue that lifelong learning process.
President Rivera Lacey says she's committed to continuing to expand the college's behavioral health services because it's crucial to students ultimately succeeding in college and beyond.
One of the things that we're recognizing is that we're really working with the whole individual. We're way past just coming to school to get a degree. We're really trying to do the education of the entire person. And what we're finding that you can have a degree, but if you really haven't done the introspection, if you really haven't dealt with your trauma, you are still not leaving equipped to be able to go out into the world and truly make a difference in a positive way.
As for making a difference, Christopher Garcia Mendez is well on his way to meeting his goal of becoming a civil engineer. And as I left the campus, I was impressed with a student-centered paradigm that is firmly in place and that seems like an essential pillar in meeting the mental health needs of college students from diverse backgrounds.
That report was from Louis Freedberg. It really shows what one college can do. And it also shows how students themselves can be a key force in addressing not only their own mental health challenges, but those of their fellow students. One development I found interesting in our interviews around the country is that mental health practitioners are being appointed to senior administrative positions on their campuses. One of them is Dr. Michael Gerard Mason. He's a longtime psychotherapist who was interim dean of African American Affairs at the University of Virginia. Along with others we talked to, he says that one hopeful sign is that the stigma among students about seeking mental health treatment is diminishing. But that's had an unintended consequence. It's created a greater demand for therapists, especially for those with backgrounds matching the diversity of their student body. Dr. Mason.
We started a movement in our state where we adopted a third-party telehealth company to partner with us to provide therapy resources to our students. So every student at the University of Virginia, and now across the state at many universities, are afforded 12 sessions with a clinician free. They were, for the most part, able to get unlimited psychiatry, and they could talk to a clinician, a listener, trained listener, infinitely, anytime throughout the day, 24 hours a day, 7 days a week. And the greatest concern initially was whether or not the students would be able to speak with somebody who shared some of these diversity descriptors, whether it was gender, race, ethnicity, and to some degree age. Those are the things that we were worried about. What we have been surprised by is that the students are actually now saying that they would like in-person work. So where we were sort of banking on this idea that this generation of students were living in their devices, very comfortable with telemedicine, what we're discovering is that they are hungry for the person-to-person, in-person work. And that is where I think the barrier is, that we just do not have enough clinicians, and particularly clinicians of color, for that level of work.
One place students are more likely to encounter more diverse mental health professionals is at historically Black colleges and universities. That's the case with Dr. Hideko Serra, a clinical psychologist who's also director of Equity, Inclusion, and Belonging at Morehouse College, an all-male HBCU in Atlanta. She says that HBCUs have a definite advantage in giving students a sense of safety in seeking help.
One of the strengths that I think we see is that our students know that they are in a place that is very much Black affirming, Black value affirming place. So they don't have to explain why they are seeking their counseling help. We don't have a psychiatrist. We don't have a medical staff. I think our students seek help knowing that they are in good hands of people who truly understand them in terms of their racial background, but there are some limitations, not only for our campus, but by counseling centers across the nation in terms of what can be done and what needs to be referred out.
Dr. Serra reminded me that taking that first step to look for help is still a hurdle for many students to overcome, especially for men. Men, she says, often delay getting help until they have more serious concerns.
Oftentimes, seeking counseling as a process is a very daunting, vulnerable, scary process for most people, especially people who have never been in therapeutic relationships before. It's a whole process of earning trust, building trust, and all of that.
Building trust is an appropriate theme with which to end this episode, and a reminder of the work that needs to be done and can be done. Thanks to our guests, Dr. Khadijah Booth-Watkins and Tony Walker from the Jed Foundation. Thanks to the staff and students at Palomar College, and to Dr. Michael Mason from the University of Virginia and Dr. Hideko Serra from Morehouse College for their insights. Special thanks to our sponsor, the Hewlett Foundation. I'm Lande Ajose. Thanks for listening.